My name is Ehsan Shami Gooshki. I'm basically a bioethicist and also a physician by training. I was associate professor of bioethics at Tehran University of Medical Sciences, Iran, and recently I joined Monash Bioethics Center. My experience in research ethics includes around 8 years work as a secretary of National Research Ethics Committee on Iran and in Iran, and also now I'm a member of Ethics Review Committee or Ethics Research Ethics Committee of the World Health Organization. Today I will present something about the call for universal registration and accreditation platforms for research ethics committees, which is related to some of the previous thoughts on harmonization and similar issues of research ethics approvals. I will start with the background, then I will present a case that I established in Iran before coming to Australia, and then my proposal briefly. As a background issue, the expansion of the scope of research ethics committees throughout their history after the World War II, and nowadays research ethics committee review studies beyond the interventional studies, and also the new scope includes observational qualitative studies, and even beyond the human studies. There are specific research ethics committees for animal and laboratory research as well. And we know that today research ethics committees are an integral part of global research picture with a noticeable bureaucratic process. And they faced critique over their effectiveness, consistency, workflow, efficiency, and real-world impact. In some cases, as we witnessed during COVID-19 pandemic, some investigators try to label their investigations and work as public health surveillance, sometimes to justify this exception from REC bureaucracy. While there are different motivations for receiving research ethics approval, legal motivations, sometimes the publication motivations, because now journals require REC approvals, not only for research and sometimes for also case reports nowadays. So the scope of REC works is expanding nowadays. At the same time, we see that REC approval is not only for ensuring observing ethical standards, but also sometimes it's a kind of assurance, for example, for journals regarding research integrity. It shows for example, it shows the research institution oversight at least. The number of fake REC approvals is a big concern nowadays, mainly from low and middle income countries. Retraction of many articles because of ethical issues shows that despite presence of REC approval, there are concerns about the quality of REC reviews. And we know that in absence of an effective oversight system, receiving approval in many LMICs should not be a big problem for investigators. So in case of rejection by one committee, another committee sometimes could do it. So it's a real global problem. And COVID-19 pandemic showed us that, and also Ebola, the issue of facilitated review started after Ebola outbreak, and ethics preparedness during pandemic is very important, and it requires facilitated review. During infectious disease outbreaks, there is a rush for conducting research. Therefore, the number of projects may increase significantly, and considering the role of RECs in each specific context and regulation that usually requires such research projects being approved by all local research ethics committees. Vertical and horizontal connection and relation between RECs is essential for an effective system communication, which is crucial for facilitated review. Effective communication requires a kind of recognition, which would be possible through the registration, and also it requires high quality review that could be possible from by implementation, oversight, and accreditation mechanisms. During COVID-19 pandemic, as this paper in the Lancet Global Health mentions, the clinical research should be changed to be more responsive to such big problems. At the same time, as the many duplicative and underpowered studies of COVID-19 treatment showed, failure to coordinate research efforts has significant cost in terms of wasted resources. Then the World Health Organization, World Health Assembly, issued a resolution in 2022 about strengthening clinical trials to provide high quality evidence. And in clause 7 of this resolution, the ethics system is mentioned that we need a more efficient research ethics system to respond to future pandemics. My case study returns to my experience in Iran when I was the Secretary of National Research Ethics Committee, who established a research ethics system by providing standards and also legal support, and also finally ethics review system with oversight mechanisms. At that time, I realized when I took the position, I realized that there is no recognition of different research ethics committee across the country. We don't know them. We don't have established relation and communication with those systems. So we started a registration process, and we registered more than 200 research ethics committees, and they were accredited first by paper-based system, and then we started establishing a national portal for registration and accreditation purposes. So we tried to do it. Finally, innovation of this system was not only accreditation, registration, and accreditation, but indexing of approval. So it means that in case any country, any part of the country approves a study, the approval will be indexed on one national portal, which is available now for public, and this indexing is synchronous. So it's online indexing system, like something like PubMed or Scopus for medical or for journals or papers. So just giving you this example of the number of research ethics approvals during COVID-19 pandemic. In the April 2020, we had 2,500 around 2,500 research ethics approvals. And when we wanted to see what's happening in the research era in the country, this portal provided us with a very fast system to do a kind of oversight for that. So the proposal, as it is mentioned in a recent WHO tool for benchmarking ethics oversight of health-related research involving human participants, I was a member of this working group, and in this WHO document, it is recommended that registration mechanism should be activated within the countries and member states to help research ethics oversight. And this could be a good start for different countries in the world. So considering my experience and this new recommendation of the World Health Organization, I can suggest that registration of RECs, research ethics committees, is really important task, and it provides the ground prepares the ground for accreditation of research ethics committees. But what makes a real difference in this field is providing and developing an indexing system, an indexing platform for REC approvals. So when you have this, there are different mechanisms that could be used. For example, during COVID-19 pandemic, we used this platform to do a kind of post-approval surveillance of research ethics committees. In Iran, the National Research Ethics Committee had a kind of superior role over the research ethics committees in the country. So we could legally do this kind of post-approval surveillance. We try to review approvals, and those problematic approvals in that indexing platform were re-reviewed by our reviewers. So it was a very good mechanism doing secondary reviews in specific and sensitive cases. And in few cases, the approval was retracted. So the problematic approvals, or those who have don't include enough deliberation, were retracted. And also this provides a mechanism for disapproving or suspending incompetent committees, and to tracking research ethics approvals from their conceptions. And this means that we can track research ethics projects. We can track projects from their inception point. And also it's a good way that would improve the consistency. It would strengthen the research ethics governance. It will increase transparency. Providing such an indexing system will enhance accountability, because research ethics committee understand that their approval would be seen and reviewed by different people, whistleblowers and stakeholders in that public platform. It provides better ground for inclusion of different stakeholders, and also would increase the consistency, because it is not a short-term issue, but in long-term and middle-term, consistency would be improved. And finally, the responsiveness of the research ethics committees. And thank you very much for this opportunity. Really, I'm now in Global Forum for Bioethics in Research in Montreux, Switzerland, and this is a picture from autumn here in Montreux. Thank you so much. Over to you.
Thank you, Ehsan. I think that's really thought-provoking, and you can look at this both ways, as bureaucratic or very organized. And I sort of feel that listening to you, happening in Australia would be pretty difficult given the number of ethics committees and potentially the lack of desire to share information. Nevertheless, I did ask the question in the chat as to whether or not people had any experience of fake ethics approvals, and I only received one response, so N of 1, but it appears to be no. So do you think this is necessary if we're not in a situation where we don't face the same sort of issues as you were facing in Iran?
Yeah, fake approvals is one of the problems usually, because my call and my proposal is more for a global indexing system, not only at the national level. It could be at the national level, but this is a big problem. And we all are influenced by those fake clinical trials. Consider those fake evidence, fake data about efficiency and effectiveness of some interventions for COVID-19 disease. So this is not only, the problem in LMICs. In the case of infectious disease outbreaks, is not only the problem of LMICs, it's the problem of the world. Usually these infectious disease outbreaks source or start point in the globe is in the global south. So this is an important point. But more important than only fake, approvals is a kind of oversight system, implementing of an oversight system, and to have more harmonized research ethics system. So I think that this indexing system will enhance the transparency and will enhance the accountability of the research ethics committees. I don't find enough ethical grounds for being so conservative about the only topic of the research that we approve in research ethics committees. It is something that the public should be aware, as they are aware in case of clinical trials, because clinical trials nowadays are registered in clinical trial registries. And I think that that's a really good example how international platforms, how indexing platforms could help the public.
Thank you, Ehsan. Great answer, actually, by the way, and quite persuasive in terms of transparency and accountability, I believe. Now, Ehsan, we're going to leave it there in the interest.